Over the past decade, we have made significant progress in reducing the number of deaths from infectious disease such as HIV/AIDS in developing nations, many on the African continent. With this success comes the chance to take on another leading killer in the developing world, women's cancer.
Cervical cancer is a major public health problem. How do we prevent? Because of course prevention should always be our focus as well. Innovative approaches to addressing cervical cancer such as see and treat and also HPV, I don't think these should be options. They should be actually necessities. It sounds as simple as that, and it is as simple as that actually. Something as simple as vinegar can actually make a big difference in women's health.
Ke sa phomalepa ke tswa go bono mo khoteng ya ga dandane ke tlo tsatseno ke tlo mo tleliniking ke tlo kopa thuso ya go checkiwa kankere mo lo mo apopelo ke bona go le botlhokwa go ta go itlhatlhoba ka lebaka la gore ha ona le kankere le bolwetse ja molomo wa kankere apopelo go kgona gore go tsenye bokoa mo go ka hetsang go dirile ntho mo go wena jaanong ka bo ke bona go le botlhokwa gore ke teke check gore ha ile teng ke thusiwe go santse go na le nako.
We know that worldwide the commonest malignancy for women is breast cancer, but when you consider sub-Saharan Africa, the commonest cancer in women is cervical cancer, and 80% will die, and that's why the whole of the sub-Saharan region is struggling to put together programs for early detection and treatment. A number of African countries has partnered with Pink Ribbon, Red Ribbon, and because of that, we have seen quite a number of a multiplier effect in terms of assistance from other companies that are dealing with both products as well as services that are used in the control of cervical cancer.
Pink Ribbon, Red Ribbon is a global organization that utilizes the power of partnerships to save women's lives from cancer. Healthy women strengthen families, communities, and nations. Through sustainable and simple screening options and increased access to education, Pink Ribbon, Red Ribbon increases awareness of breast and cervical cancer, promotes early detection, and provides necessary treatment, and ultimately saves lives. Pink Ribbon, Red Ribbon works alongside country partners to vaccinate girls against the human papillomavirus. When girls and young women are vaccinated before they've been exposed to HPV, the likelihood they contract cervical cancer is much lower.
It's not an option, it has to be done. We can't afford not to screen our women. We can't afford not to vaccinate our women, our girl child. So these are not options or choices that we can make. No, it's absolutely necessary.
In many societies, if not all societies, women are really the keepers of tradition, and they keep the family together. If there is no woman, there is no mother. That's literally the end of our dreams for many, many children, particularly if the younger children. And that's the urgency of the whole issue. We need to preserve the health of our women, because if this woman is not there, the whole family just crumbles. Okay, Pink Ribbon, Red Ribbon coming to the aid of countries, a very big plus. There are many people that do work such as we do. We feel particularly privileged. What you're doing here gives us hope that we'll have the support that we need to continue this work next year and the year after.
We believe in a timeless truth. Of those to whom much is given, much is required. Together with our global partners in government, nonprofit, and corporate sectors, we have a responsibility to further our work and build on our momentum in the fight against disease. Through Pink Ribbon, Red Ribbon, we can ensure that more women not only live, but thrive.
Ke tla bua le bone ke ba rotloetsa ka gore le bone ke tla bua le bone gore ba tle ka gore nna ke setse ke itemogetse gore ga gona botlhoko jo bone ba setseng ba kaile gore ba a botshaba. e mma inthusitse ke ka gore ke bone botlhokwa jwa teng.